thank you very much for inviting me to come to give a presentation. I've titled this Young Adolescents in Sleep, a Gathering Storm, with a shout out to Mary Carskadon. And you have probably heard more sophisticated talks, but I hope that this one will stimulate some thinking about adolescence and about culture and sleep. So I have nothing to disclose. So the objectives of this session, at the end of it, hopefully you'll be better able to appreciate how culture may shape sleep, identify a wide range of factors shaping young adolescent sleep patterns, and instrumentation to measure them, and understand advantages and challenges of using technologies to study young adolescent sleep. I like to present kind of a roadmap so people know where I'm going. I'm going to talk a little bit first about culture and sleep, then move on to sleep regulation, circadian rhythm, talk a bit about adolescent sleep changes and this metaphor, the perfect storm, and then talk a bit about the evolution of my work to understand child and adolescent sleep and sleep disparities, and then end with describing some challenges with the work that I do. So most people, when you meet people on the street, they learn you're an anthropologist. They think of you as an archaeologist. You know, aren't you the person who digs up bones? And people might think, what does anthropology have to contribute to sleep research? Well, you know, despite this video evidence of Paleolithic age humans using a hammock for sleep, which emerged during the 1960s, that's been recently refuted. And I don't know if you caught this, but in August issue of Science, these two paleoanthropologists reported discovering bedding, basically, going back 200,000 years in this border cave in the Lobobo Mountains of Southern Africa. So this is the cave right here, if you can see my cursor. And these are fossilized grass fragments. And this is astounding because, I mean, people estimate Homo sapiens appeared about 310,000 years ago. So this is reaching way back in the history of our species. And what's really interesting about it is that these are fairly sophisticated. This bedding consists of layers of grass fragments or grass, and then ash, and it's believed that the bedding, the grass is there for comfort, and the ash might actually be serving sort of a pesticide kind of role, where that ash has very fine-grained particles that get into the breathing tubules of insects and make it difficult, if not impossible, for them to breathe. So a really interesting innovation, if you will, in bedding. Very, very early on in our human history. So we do have something to contribute. I'm an anthropologist, as Kingman said. I'm interested in studying how characteristics of the cultural and social environment shape children's sleep health, and with a focus on sleep in particular. I've also been involved in work in child maltreatment work. So what do we mean by culture? I think in its most basic form, culture consists of patterns. And those are patterns of thinking, patterns of doing, patterns of even feeling that are shared and that are passed down from generation to generation. So they are learned patterns. Now, I wanted to show you this picture of a sleep setting, probably one not typically seen in Northeast Ohio. And if we were in a room, you know, at a Zoomless meeting, actually meeting in person, it'd be fun to have more of a discussion about this. But just look at this picture and just take, you know, we'll take a few seconds, look at this picture and think about the setting and the characteristics of this setting for sleep. So you might notice a few things. I'm just going to point out a few of them. So these are acacia branches from an acacia tree that have been cut down to supply a windbreak, basically. It's constructed, provide a little break from the wind. You can see that there's fire between each of these individuals to provide a little heat and warmth during the evening. This is a female co-sleeping with an infant. You can see too that the clothes have been removed. And in this case, looks like one potentially used as a pillow. In other groups, so this is a picture of an Aboriginal group from Australia. And in other similar groups of individuals, we're told the individuals tell us that they can remove their clothing too, out of a concern for the fire, that they don't want their clothing to catch fire if they're that close to sleeping that close to a fire. There's a couple of things in this picture that are interesting that you can't see it from a still photo, but it's interesting to take note of. One is that this doesn't capture location or movement. And this is a group of people who may be sleeping in a different location every evening, right? Depending on their movement during the day for their subsistence. And another thing that's not captured by this picture is this area of the interpretation or the meaning of sleep, which can vary across cultures. So, depending on your group, sleep may be a time that has special salience in terms of spirituality or the sacred. It may be a time that's deemed vulnerable for a variety of reasons. And you also don't get a sense here of the timing or the patterning of sleep. So just to illustrate, sleep-wake patterns may differ across cultures. This is some interesting work from Sampson and colleagues. They studied this Hadza hunter-gatherer group in Tanzania. And this figure just illustrates some of the differences across culture in sleep-wake patterns. So you can see the Hadza have a one primarily nightly sleep phase, and then an afternoon nap. Contrast that with what historians tell us about pre-industrial sleep in Western Europe, this notion of first and second sleep during the evening, versus our post-industrial economies with heavy societal activity demands, where people sleeping roughly one time from in the evening, and then compare that to a small-scale non-electric agricultural society in Madagascar, where there are multiple patterns or phases of sleep, if you will. So what I'm trying to say here is that there's lots of cultural diversity in sleep around the world. Diversity in terms of the physical environment of the sleeping area, diversity in the social environment of the sleeping area, who's sleeping with whom, the preferred timing of sleep, and then the interpretation and meaning of sleep. So I'm going to switch gears a little bit now and talk about sleep regulation. I'm sure this is nothing new to everyone here, but sleep is conceptualized as involving two interacting processes. And one is process S, which is the sleep-wake homeostatic process. And this controls the depth and length of sleep as a function of prior waking. So the longer you stay awake, the sleepier you get. The longer you get insufficient sleep, the sleepier you get each day. And the catch-up sleep then following deprivation, especially deep in REM. And the other process that's involved is the circadian timing system, and that's process C. And our planet rotates. There's a period of light, period of darkness, and life on the planet has evolved to account for this change. And the circadian system generates a cycle to match the solar day and maintains an appropriate phase relation to it. That is, it harmonizes body functions to that appropriate phase, light and dark. Entrainment is the process of that optimal synchronization with the environment. And that's mediated by environmental stimuli or Zeitgebers, literally time givers, acting on the clock. So probably the most well-known, powerful one of these Zeitgebers is light. The absence of light triggers secretion of melatonin from the pineal gland, which starts that slowdown process to sleep. And then the presence of light blocks the signal to the pineal gland. There are notable individual differences in light sensitivity. This Chalapa 2020 article, it's hot off the press. Literally, I opened my email yesterday and saw this. You get these notices about articles in your area of interest. And this is a review article I looked through on individual differences in light sensitivity in the circadian pattern. So I'd encourage you to take a look at that, and I can provide references for these if you're interested. Just let me know. The body may also respond to other environmental cues, such as temperature. The intrinsic period seems to be just a little over 24 hours. It's slightly shorter and earlier in women compared to men. And there is some evidence that there may be differences by race, ethnicity, with some evidence that African Americans may have a shorter period compared to other individuals. But that's the circadian timing is something that seems less studied, actually, at least in the literature I'm familiar with, compared to more kind of standard, total sleep time, wake after sleep onset, those kind of characteristics. Just trying to find a place where I could put this so it's not in the way. Whoops. So measuring circadian rhythm can be complicated. I am no expert in this in any stretch of the imagination. And this is my conclusion from reading the literature. There are some certain characteristics of the circadian rhythm. Tau is the endogenous period of the clock when it's free running, and that's best measured via some really elaborate lab protocols, like a completely isolating environment, like in a cave or something like that, where somebody's cut off from light, and they can basically the circadian period starts to called free run. And this period of the clock can also be determined in situations or lab conditions of forced desynchrony, which sounds pretty awful to be a participant in. But in these protocols, subjects are scheduled to either very, very long rest activity cycles or very, very short. And the period's way outside the range of entrainment of the circadian pacemaker. And so it continues to function. And through these elaborate protocols, you can figure out the period of the clock. And what this figure on the right here, which I took from Where's Justice, this is the roughly 24-hour cycle. Here's a period of light. This is noon, and here's after the light, the period of darkness at night, and the green bars are sleep, and then this would be the following day, basically. And these are set up, they put a bar in between each one so you can kind of see it a little bit earlier or easier. But you can see here that in these first, this is an example of entrained sleep. So it's pretty stable. Person, falling asleep, waking up at pretty much the same time over the course of the several days. And then in a condition like that isolation, where their clock is allowed to free run, what's typically observed is that period shifts, basically. And here, another important characteristic that people look at in terms of these circadian rhythms is what's referred to as phi, or phase angle. And that's the difference between the phase of a given circadian rhythm, something like sleep onset, and the phase of a Zeitgeber, like dusk or dawn. And some examples of that are down here in the bottom. So here is the phase angle that is measuring the difference from the sleep midpoint here to the light and day cycle. Here's another example. This is the phase angle from the dim light melatonin onset to the light dark cycle, sorry. And the last one is the phase angle of the dim light melatonin onset to the sleep midpoint. So there's tau, the period of the clock, there's phi, this phase angle, the difference between the rhythm, a phase of the rhythm and a phase of a Zeitgeber. Individuals, people interested in this area also look at amplitude or changes in amplitude between points in a cycle. I will say that it's challenging to measure these endogenous circadian characteristics in naturalistic settings, kind of work I do, because the Zeitgebers, behaviors all mask or affect these rhythms. So there are a variety of tools that have been developed for trying to measure some parameter of the circadian system in observational or naturalistic settings. So there's validated instruments out there for circadian preference, a chronotype. You may be well familiar with these, the morning eveningness questionnaire, the unit chronotype questionnaire. People also use information collected from diaries or from actigraphy. So parameters like the sleep midpoint, that halfway point between bedtime and wake time. There are some interesting, I was going to mention the sleep regularity index, which is the percentage probability of an individual being in the same state, asleep or awake, at any two time points, 24 hours apart, averaged across the whole study or observation period. So that gives you a sense of the stability of that pattern. And then there are some interesting analytic techniques or packages that have been developed to investigate actigraphy parameters and develop measures from those. So this one I've noted here, the nonparametric circadian rhythm analysis. This is an interesting analysis package, if you will. And there's no assumptions about distribution here. So it doesn't assume a kind of that regular oscillating pattern, and therefore is good for situations where fragmented sleep is considered or expected. And these packages basically create several measures. And I've listed a few that are derived from actigraphy data in this nonparametric circadian rhythm analysis. So things like this interdaily stability, the degree of resemblance between activity patterns on individual days, interdaily variability that quantifies fragmentation of rest and activity patterns, L5, where you basically overlay all the days and average the activity for each hour. And then the L5 is the mean activity level for a sequence of at least 5 active hours, of the least 5 active hours, so presumably sleep. And then M10, which is the same process. You overlay all the days, you average the hour activity, and the M10 is the mean activity for the sequence of the most active 10 hours. And then this last calculation, relative amplitude, or the ratio of that L5 to M10. And I have to say, as I was reading through these, it's sort of like what came to mind was the tool and trying to then learn how to use it. I don't see many studies in the areas I've been involved with that actually use these measures. And it's probably at a point where they're still trying to determine what normative measures might look at. But it could be good for comparative purposes if you have two populations, you're trying to understand some of the differences. But I just want a sense of what's out there for measuring circadian patterns. So I'm going to switch gears again and talk a little bit about adolescence and changes in adolescence. So there, of course, are a host of biological, psychological, social changes that are occurring during adolescence. There's an activation of the hypothalamic pituitary gonadal axis, which then leads to gonadal steroid hormone production and sexual maturation. There's increase in growth hormone, rapid physical growth, increased height, physical changes of sexual maturation. There are changes going on in the brain structure and function. Dendritic pruning is occurring to remove unused synapses. There's increased myelination, which is thought to augment information processing speed. And there's a host of psychological and social changes during adolescence. Changes in emotional regulation, changes in identity, independence, affiliation with peers and parents, increased academic demands, extracurricular activities, and work. So a whole host of changes going on during this time. So I suppose it would, we'd certainly expect then that we'd see changes in sleep in adolescence as well. And in terms of process S, during adolescence, sleep pressure builds more slowly during that period of wakefulness. And interestingly, that's occurring, but the rate at which sleep pressure is dissipated during sleep seems to stay the same, which would suggest that the sleep need doesn't change the same. There are also changes in process C. The central circadian clock shifts later, that famous adolescent phase delay that seems related to puberty. This is observed in several mammal species. Girls show the shift earlier than boys. The maximum delay occurs earlier in girls, but generally the magnitude of the shift is greater in boys. And this is observed across several continents and cultures, although the peak delay may be earlier. The precise mechanisms that are underlying these changes are still unclear. Can say that they don't seem to be due to just like a lengthened endogenous circadian period of older adolescents compared to prepubertal or younger adolescents and adults. They also don't seem to be due to a altered response or sensitivity to light in older adolescents. That is, if they had like a greater response to evening light, which would then, kick that delay, or conversely, more of a blunting of a response to morning light, which would advance that delay. So the mechanisms for this still seem unclear. Some other changes in sleep: a shift in chronotype towards eveningness, a preference for eveningness, and this trend seems to reverse around 20 years of age. Sleep architecture changes, is a reduction in slow wave sleep, and it's believed that might reflect this underlying dendritic pruning, which is occurring during adolescence. And REM decreases in absolute terms, but not as a percent of total sleep time. As I said, there's a shift in timing later, even when unconstrained by school. And this leads to a decreased amount of sleep. So you may be familiar with this, 1991, the perfect storm. This was formed by the convergence of three factors, basically. You had a high temperature or a high pressure area moving down from Canada, bringing cool, dry air to a region of the Atlantic to the east of Nova Scotia. At the same time, the Gulf Stream was bringing up a massive warm air pushed by a low in the southern part of the United States. And then you had Hurricane Grace swimming in the Atlantic and basically providing a huge amount of tropical moisture to this area. And it actually formed a hurricane. I believe it got to category 2, unnamed, and did a fair amount of damage in New England and in Canada. You might not, if you don't remember the storm itself, you might have read Sebastian Junger's book, The Perfect Storm, or more likely, you might have come across a rerun of the 2000 movie, The Perfect Storm, when you're, channel surfing one day, that starred George Clooney and Mark Wahlberg. Now, Mary Carskadon, a real renowned sleep researcher, a lot of work with children, with adolescents, and from living in New England, of all things too, I think saw in this perfect storm a great metaphor for what she described in an article in 2011 as this perfect storm of adolescent sleep, a convergence of forces. So you've got these changes in process S and C that are that involve slower sleep pressure, and circadian phase delay, coupled with changes in psychosocial characteristics, more bedtime autonomy, increasing academic pressure, increased screen time, increased social networking, and these leading to this change in the timing of the rhythm of sleep, what she referred to as ill-timed. And then the real kicker, the third force, is this school start time. So these two forces on the left, converging with this third force on the right, leads to not only ill-timed sleep, but also shortened sleep, which is the perfect storm for adolescent sleep. So how did I get interested in this? Kingman mentioned that I worked for a period of time with Susan Redline as a postdoc, and she had some really interesting data around the sleep of basically a cohort of a little over 700 children in the greater Cleveland area. And I was examining data from when the kids were like 8 to 11 years of age. And we were doing something, believe me, it's Jim Spilsbury, nothing sophisticated here. Just looking at very simple, sleep duration by gender, by ethnicity. And this, what you're seeing here, this figure on the y-axis is adjusted mean sleep duration in hours, and the x-axis basically are ethnicity, gender groups. So white girls, white boys, African-American girls, African-American boys. And you can see sort of in that Cleveland brown orange, as you might expect, that for all these groups, they're sleeping, have a greater sleep duration at 8.5 years than they do at 10.5 years. But what really struck me in these data were this really noticeable drop in African-American boys, compared even to these other three groups. And these trends continued as they got older, as adolescents. And so if you'll pardon me, in keeping with Mary Carskadon's theme or metaphor, I thought about this maybe in terms of the gathering storm, right? I mean, you're seeing changes that are then going to continue and perhaps exacerbate as these kids get older. Since that time, there's been a fair amount of literature examining sleep disparities by socioeconomic status, disparities by race, ethnicity, by majority, minority status, and these disparities have been pretty consistently observed. And there have been a literature on what's influencing sleep. So what are some of the risk and protective factors for children and adolescents? And there's been enough of that where there are actually now meta-analyses trying to examine, collectively what the literature says about risk and protective factors. This is an interesting meta-analysis, Bartle and colleagues, from 2015. And what you're looking at, so these are, a list of potential risk, protective factors. The measure is the mean weighted correlation coefficient and the confidence interval. That's weighted by sample size, basically. And you can see here, up at the top, here's a range. This is total sleep time. So this is a decrease, and these are factors or risk factors like computer use, evening light, a negative family environment. Contrast that caffeine use. Contrast that down here's work. Contrast it down here with some protective factors like a parent set bedtime, good sleep hygiene. Some more recently investigated factors involve what could be considered neighborhood characteristics, or what, kind of what's going on, or what's the neighborhood setting like. And so far in the literature, factors that have been examined include the neighborhood socioeconomic status, or median income, those sorts of measures for the neighborhood, noise and light in the neighborhood, factors like violence and crime, and also this construct called collective efficacy, which deals with the connections among neighbors, the mutual trust among neighbors that permits neighbors to kind of work together for common goals, like protecting children, watching, monitoring children, those sorts of things. And there's also been work done in discrimination as a factor that might shape, as a risk factor that might shape sleep. And this discrimination can take the form of more real overt acts of discrimination, as well as more subtle, what are referred to as daily hassles or microaggressions. So the kind of thing is, if you're a person of color entering a store, and you notice that the store clerk or the store workers are sort of following you around, right, monitoring your behavior. Or this is just a quick picture of a checkout, right, at a Best Buy or a store like that, right, is there differential behavior. You get singled out more. So this work has involved both those kind of elements of discrimination or daily hassles, microaggressions, with some indication evidence that those do come into play in terms of associations with sleep. So I was interested in getting it seemed like the sleep setting, there's so much that's going on there in a home. You've got the influences of the family, the physical environment, the social setting, you got the neighborhood outside. And it seemed to me this was an important area to look at. And I was actually interested in trying to figure out if we get better measures of the sleep setting. And I thought a lot about ecological momentary assessment. And EMA is a collection of methods by which a research participant repeatedly reports on symptoms, affect, behavior, cognitions, whatever, close in time to the experience and in the natural environment. So to give you an example, I live, this is Lakewood, I live here on Avenue, and if I were doing a study on, say, fatigue, tiredness with adolescents, I might set up a system where the system is pinging, it's texting my daughter periodically through the day. So we would start out here, she might get a ping, what are you doing? And she'd respond to that. How tired are you? She'd rate it on some sort of Likert type scale. And then she might get another ping when she's at school in those pre-COVID days at 10:15. What are you doing? How tired are you? Get the same message at 12:40 if she's having lunch at Melt Bar and Grilled. 1:15, again, a ping. And then a last ping at, let's say, 3:45, answering the same questions when she happens to be at Madison Park. And that's sort of the approach. I mean, you think about it, and ostensibly what you're getting is a multiple measurement, which is good, and it's in that setting right at that moment. So potentially leading to more accurate reporting from the participant. So could you do this with sleep? Now you can't wake people up to ask them what's going on, but potentially the system could be used to collect information around key time points like bedtime or wake time. You could also note key events, what's going on in that environment in terms of activities of the participant and other household members, or nighttime disturbances and events. And again, you can't wake people up, but at least trying to collect this information at certain key points when it's happening. So this was the first step to try to understand these differences through this enhanced measurement, if you will. This was a grant from the National Institute on Minority Health and Health Disparities. Specific aims to determine effects of peers and family organization on sleep timing, and similarly effects of peers and family organization on activities before and after bedtime, and these effects on nighttime activities on sleep duration and timing. And the most important thing, which I wanted to show this morning, and I underlined, was to collect usability and feasibility data on an innovative phone sensor system designed to enhance measurement of nighttime activity. And this tries to incorporate some of this EMA sort of approach. So I must give a tip of the top hat to Kingman. Kingman, I don't know if you even remember this, but because this project involved a sensor, it was considered an investigational device. It wasn't out on the market, which meant that for the IRB to approve the protocol, the University Hospital's Electric Safety Committee had to review it and approve it first. And this proposal, this project languished for a long time in this committee, as I don't know what they were debating, but they were, who knows? And I remember running into Kingman in the hall once. He was asking me how things are going. I was no doubt lamenting, this situation. And I don't know who you call, Kingham, or who you emailed, but I soon got approval from the Electrical Safety Committee, a UH, so I could then attach that letter to my IRB protocol and for it to get approved. So this was the actual system. It was called a Wocket, from the sensor from the Dr. Seuss's Wocket in My Pocket. Kind of an ugly looking thing. That's what the kids told us for sure. You wore it on the wrist, kind of like an actigraph. The actual sensors are these A and W things here. And, there was a charger and these bands that kids would wear. And the way the sensor worked is so it similar to a Respironics actigraph. The Wocket is basically collecting motion data. It's sending that to a nearby smartphone, which then in turn, if your service provider works, like AT&T, you have connectivity, it sends that information onto a protected server, which in turn sends it to a computer where you can do some real fancy analyses and come out with counts of activity that can then be through algorithms transformed into sleep and wake, all sorts of things like that. And there's an added connection in that this system is live, it's real time. So you can look and see if the data stopped for any reason, and then go back and check, is the Wocket functioning? Is it being worn? Is there an issue with connectivity? That sort of stuff. So this system had some real advantages. It's real-time monitoring of movement and also sound. You could use the microphone in the phone as to gather sound data. You can link the information that you're collecting to surveys that you give the boy or girl. And this is really interesting. So you could query for a change or a spike in movement and sound over the course of the night. And we do this in a morning survey. So the question might say, last night around 11 p.m., you moved around in bed a lot and maybe even got up. What did you do? What did you do? And there'd be a list of options in the survey that the boy or girl would respond to. These are just some example pages off of the survey that were presented on the smartphone. So, activities, naps, bedtime, or wake time, or get out of bed time. So this had a small study, 26 participants, all 11 to 12 years old. I'm not going to read through all these. The sleep was monitored for 14 nights. This was a home-based study. And just to give you a feel for what some of the data look like, the way this is presented is on the x-axis are activities, right? Potential activities. And then the y-axis is basically the proportion of nights, or the proportion of those 14 nights, if we got data for all 14 nights, that this activity occurred, basically. So for example, this figure right here, and this is, you can see it's a little darker, so there are probably a couple, 2 or 3 kids up there. So basically 100% of the time, or every evening when this boy or girl went to bed, others in the household were watching television, right? And you can see the range of activities. This one down here, I think, is a little more interesting. One of the questions we asked is, are basically the things that your family are doing that's making it hard for you to get to sleep or to stay asleep? And you can see that there's a cluster of them with other household members, watching television, listening to music, and that's making it hard. They're doing it at that moment at bedtime, making it hard for these boys and girls to go to sleep. Here's another set with people on the phone or texting. Here's this one. Here's visitors, right? Having visitors at the home. And this is a table of showing associations between our organizational measures and those sleep disturbing activities. And the thing that I wanted to highlight here is we took a measure of, this is called the chaos, hubris, and disorder scale, which sort of measures the level of what would you say, disorganization, kind of chaos in a family setting. And you can see, as you might expect, that the odds of kids complaining that visitors were disturbing their sleep, or identifying TV and music as a disturber, or people phone and texting, the odds of that increased as the score with an increase in this chaos scale. And conversely, if the boys and girls said nothing was going on to disturb their sleep, it was a lower odds ratio, right? So as chaos score increased, it was less odds that the boy or girl would say nothing was disturbing their sleep. The other interesting thing I just wanted to point out really quickly is the kind of high odds ratios with certain rules, like not family rules about like not having a snack in bed, or you can't use your cell phone. And those certainly seemed areas to worthy of further exploration. So I'm sad to report that I sort of struck out in the next iteration of this project. There were a couple of program announcements, funding mechanisms focused on sleep disparities. My proposal wasn't reviewed, but I ended up talking to a colleague one day and complaining about that, no doubt. And she said, you ought to talk to Carol Musel over at the School of Nursing. She does interesting work with family functioning, with self-management. It seems like you might have a connection. And so I did, and we really had a kind of some mutual interest. And her expertise, like I said, is self-management of symptoms or conditions, and those could be sleep related in principle. She also told me about what's referred to as the Symptom Science Initiative, sponsored by the National Institute on Nursing Research, which goal is to advance understanding of symptoms, which frequently co-occur with other acute chronic illnesses and conditions. So the more we talked, we thought, this might be an interesting avenue for funding for this kind of project. Of course, we got to pick a symptom, and what we ended up focusing on was fatigue, that experience of feeling tired or exhausted or worn out. It's a frequent complaint of adolescents. There's a similar pattern of disparity in fatigue as there is with sleep. It's associated with poor sleep. Some of the smaller scale studies I've been involved with, we have measures of daytime sleepiness. We also have items that reflect fatigue. And looking at the Pearson correlation coefficients, it seems, it's a distinct construct. It's somewhat related to daytime sleepiness, but the correlations can be low. And we think, given association with poor sleep, a better understanding of sleep disparities might lead to a better understanding of fatigue and its disparities, and ultimately its effect on functioning. So building on our pilot study and with, collaborating with Carol, we've put together this proposal, Sleep Disparities Role in Adolescent Fatigue and Functioning, a mixed method study. And the purpose is to identify key mechanisms underlying observed racial and economic disparities in key sleep domains. So duration, quality, regularity, timing, and how in turn these disparities lead to disparities in fatigue, daytime sleepiness, and ultimately functioning in early adolescence. This proposal is going to be reviewed sometime between October 28th and 30th at the study section. So I am no charlatan, right? I don't claim to have knowledge or skill in many areas that this study is going to involve. That's why I assemble a team. I mentioned Carol Musel. Stephen Antilli in the lower left is the engineer that I work with. He's at Northeastern, who developed the Lockett system. Sanjay Patel, some of you might know on the right, is bringing expertise in sleep as well as actigraphy. And Carol Rosen, who many of you probably know, is providing some expertise in terms of adolescent sleep. So this, in a nutshell, is the study schema. What we're trying to do here is the basic idea is that, you know, different race and SES are really manifest in different constellations of these risk and resilience factors, and those can occur at an individual, a household or family, or even a neighborhood level. And those influence sleep, which in turn may influence daytime sleepiness, as well as fatigue, which in turn then would affect adolescent health functioning in domains physical, emotional, and social. That's sort of the schema for the study. Aim 1 is really more of a qualitative aim, which is trying to understand how adolescents and families conceptualize these constructs like fatigue, like daytime sleepiness. What are the self-management strategies they're using? How do they experience discrimination, unfair treatment, information about routines, sleep rules, the bedroom environment, and neighborhood environment? And this information will be critical in terms of us developing and refining the questions that we ask the kids. Aim 2 really looks at the effects of race, socioeconomic status, and their interaction on sleep, daytime sleepiness, and fatigue. Aim 3 really focuses on the potential mediation of these risk and resilience factors, mediating between race and socioeconomic status and then sleep, as well as mediation among these factors. And then Aim 4 looks at the mediation of fatigue and daytime sleepiness, those variables mediating the association between sleep and various sleep domains, and then adolescent functioning. So this is going to be a sample of 175 African American and 175 white adolescents, 1 adolescent per household plus a primary caregiver, 11 to 14 years of age. We're going to develop a balanced sample in terms of socioeconomic status, looking at the income to needs ratio. We've had some success in being able to do this in other studies. You can see there are going to be exclusion criteria in terms of certain diagnosed conditions that would affect sleep. And we're going to be recruiting through 2 main avenues: the Open Doors Academy, which runs a large number of out-of-school activities for like 800 families in the greater Cleveland area. There are connections throughout the area. And then my department's Prevention Research Center for Healthy Neighborhood has we're forming an advisory board that's going to help advise this project. And it also has a large network of community partners that will help us in recruitment. We think the strengths of this proposal, it's addressing these priorities and interests of the NIH in terms of sleep disparities and symptom science. Community partnership is a strength in this. We're going to need community to help us in our interpretation of data as well as recruiting efforts. It's a mixed methods approach, so we're strategically collecting both qualitative and quantitative data to use those jointly. We're using this piloted innovative technology and having a 14-day observation period where the boys and girls will be using these devices. We're going to be hopefully disentangling the effects of socioeconomic status from race, investigating different forms of discrimination, and disentangling sleepiness from fatigue. Identifying pathways, these mediating pathways through which these factors like economic status and race may shape sleep, fatigue, and ultimately functioning. From an analytical standpoint, we'll be using a generalized linear mixed modeling, which really has some advantages in that it'll count for both differences across kids as well as day by day differences within kids. It can also handle what we call time variant or daily measures. So rather than just doing a 14-day observation period and getting the mean of some parameter, we're actually able to analyze every day, a value each day over those 14 days. And that really adds to power. It's really statistical power. It's really advantageous. We can also test moderation effects of biological variants. So do these relationships that we see between our key variables differ by sex, by pubertal status, by menstrual status, and distress, in this case, menstrual pain. I'm not gonna, in the interest of time, I guess I'm not going to wade through all this. I didn't plan to anyway, but I just wanted to show you really quickly that what we were trying to do, these are our sleep variables. So those domains of duration, quality, timing, regularity, morning, eveningness. We're trying to collect both baseline or time invariant, as well as time varying measures, so a nightly measure. And doing similarly for fatigue, we're also collecting information on daytime sleepiness, of course, and oh, I forgot to put the scale in, and the morning eveningness preference. Just some more of our variables, our key outcome, adolescent functioning, using the pediatric quality of life inventory to look at specific domains, and then a host of these individual resilience, household and family resilience, and neighborhood resilience factors. Similarly, looking at a host of individual and household family risk, and again here trying to collect where we can both baseline or invariant as well as time varying information that we can analyze sort of on a daily basis. And these are some more of the household family risk. You can see down here with in particular these family activities at bedtime, sleep disturbing behaviors, adolescent nighttime activities, adolescent sleep disturbances. Will we be able to collect information on the type of disturbance, its duration, its intensity? And then lastly, neighborhood risk factors. So poverty, violence, crime. We have a whole host of covariates, as you might imagine, demographic variables, school attendance, pubertal status, medication use, BMI, caffeine use, and then other conditions that might be shaping sleep, as well as violence exposure and adverse childhood events. I'm going to skip through this. This is just a little more detail about the analysis, but I just wanted to end with some of the challenges in doing this kind of work. One is really a challenge of language and perspective. I'm trained in anthropology. Stephen and Tilly here is an engineer, and we literally speak a different language. And part of the trick and challenge of working with teams, multidisciplinary teams, is really learning to work and communicate with other experts from other disciplines. And that's a challenge. For those of you who watch Star Trek: The Next Generation, Jean-Luc Picard, the captain, used to say, "Make it so," when he wanted something to happen. And I think I suffer from that syndrome. Oh, we want to measure noise spikes at night, for instance. Well, yeah, Steve, just do that, right? And there's really a lot that goes into, how are you going to measure noise at night? How are you going to look at individual spikes? Are you going to look at overall and average amplitude? How are you going to identify the events you want to look at? He's got to take what the team wants and actually turn it into like an algorithm that a technology is going to be able to use. And one of the big lessons of this, of course, is really needing adequate time for developing, for pre-testing, for modifying these features in a system like we're proposing to use. There's another real challenge is keeping up with the technology. So I ran cross country in high school. Every Saturday morning during the season, we had an invitational. There'd be a couple hundred kids running the race. This is how I usually saw the race. Kind of like looking at the backs of many, many runners. And this reminds me of this keeping up with technology, because technology is continually changing. And the device that you thought you were going to use, by the time you actually, buy them or get to use them, there's already been advances made, and that can be a real challenge. And just for instance, the Wocket that was used to develop that initial system, that's no longer in use. Stevens moved on to smartphones, for instance, and using the motion sensors in the smartphones, having a much a real advantage to that. Sometimes the challenges involve the technology you already bought and purchased. We didn't count on the fact, we didn't think about it, that we were giving these kids smartphones in our Wocket system, and that there would be updates, periodic updates from the software that would then screw up the software that Stephen and Tilly and his, had put on the smartphones to be handle the Wocket system. So, we lost initially in the study, we lost unfortunately, some evenings because the system had updated, and so you didn't get any data, it stopped. And, fortunately for that, it was a relatively simple fix, and making sure the software is updated and tested before you leave the office, and then turning the auto update off, really important. Room logistics can be a challenge. These are all home-based studies. There might be poor electrical connections. There might be a poor, provider service. There might not be a good place to put the phone, right? Or the system in the bedroom. We were able to handle 2 out of those 3, at least, in terms of providing like that little table there and an extension cord when we needed. Couldn't do much about the connectivity with a provider like AT&T, unfortunately. One of the challenges is we don't want the device itself to change the behavior of interest. And think about it, we're giving kids smartphones. That doesn't sound like a good thing to do. And so what we could do at least is try to limit as much as we could the use of the smartphone. So there's a data only plan. We put on a parental control app where basically the only thing the boy or girl is able to do are the study related activities. And then lastly, a real challenge is addressing privacy concerns. And this is another area where our community partnerships are really going to play an important role. As you know, this system, it's collecting sound, it's collecting location. We're not collecting images, but everybody knows that there's cameras on phones. And so these are real concerns by potential participants about what's going on with these data. How are they being, are you using the camera? How are these data being collected? What are you going to do with them? Are you going to be sharing them? All that kind of stuff. And so we'll be working very closely with our community partners to allay participant concerns about those issues, because those will certainly come up. So I think that's what I have. I'm sorry if I ran over.